pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Welcome. Just so everyone's aware, the meetings are videotaped and recorded. We'll start with new business and approval of the July 12th, 2017 minutes.
I'll make a motion to approve the July 17th minutes. Yeah.
July 12th?
July 12th minutes. Second.
Any corrections or conversation regarding the minutes? Hearing none, all in favor of approval of the July 12th minutes, please state aye.
Aye.
Aye. Motion carries. Move on to the fiscal report. And I see it's in yellow today, so I don't forget you.
Oh, because it was blacked out the other
Right.
In the general fund, we have $570,000, $570,709. Erie Bank, $529,586 for a total of $1,100,295. Coming out of the general fund this week will be accounts payable checks so far totaling $164,260,000. Estimate for healthcare $65,000. That invoice hasn't arrived yet. Dental coming out at $4,287, leaving a projected balance of $337,162. Our actual balance in the account is higher mostly because of outstanding checks that haven't cleared yet, which is why we haven't requested another transfer of anything. Just kind of watching daily how that flows before, to see if we have more cash coming in before we have to request another draw. We did in between the last business meeting and this last commissioners meeting and this one take another draw on the tax anticipation note, which brings it to $3 million that we've drawn now. And I misstated that at the last commissioners meeting, saying it was $3.5 million. At that time it was only $2.5. So we're up at $3 million now. That's it.
All right.
Move to approve.
I'll second that.
Any discussion? Hearing none, all in favor of the fiscal report as read, please state aye.
Aye.
Aye. Thank you, Judy. Moving on to renewal of special risk accident insurance. This is insurance that we have gone ahead and purchased to cover our volunteers that go out into maybe on a special assignment somewhere so that they're protected in case of an accident. This is a renewal policy. We did implement this last year, and the renewal price is $435. Do I have a motion to approve this?
So I'll second that.
Any discussion? Hearing none, all in favor, please state aye.
Aye.
Aye, motion carries. The next item on our agenda is a resolution 3087 supporting the Stepping Up initiative. And I'd like to turn this over to Commissioner Eggleston because he's the one that has brought this to our board, and I will turn it over to you.
Very good. Thank you.
You're welcome.
I have a prepared statement for this, so bear with me. Get to listen to me bloviate for a few minutes. Stepping Up Initiative is a joint effort supported by the National Association of Counties and the American Psychiatric Association to combat the epidemic of persons with mental illness in the prison system. The number of people with mental illness in U.S. jails has reached crisis levels. In counties across the nation, jails now have more people with mental illness than their psychiatric hospitals. The human toll of this problem and its cost to taxpayers is staggering. Jails spend 2 to 3 times more money on adults with mental illness that require intervention than on those without those needs, yet often do not see improvements to public safety or these individuals' health. In Warren County's case, with the reduction of beds in the state hospital due to the Olmstead Act, as well as the closing of the forensic unit at the state hospital, we have seen an increase in severe mental health cases in our jail and criminal justice system in general. Warren County also has an issue with drug and alcohol cases in our prison system, which is estimated that over 80% of our inmates have charges related to drugs and alcohol. and that's, I think, being generous. In response to these issues, I brought a resolution proclaiming the county's support for the Stepping Up initiative. Similar resolutions have been passed by over 375 counties across the country, and by passing the resolution here, Warren County will become the 17th county in Pennsylvania to adopt such a resolution. At least this, as far as the current data suggests. Stepping Up asks communities to come together to develop an action plan that can be used to achieve measurable impact in local criminal justice systems of all sizes across the country. This resolution is non-binding and is simply a statement that we intend to make this effort a focus of our administration and the county government in general. I think the concept of this effort is summarized very well in the 6 questions the program suggests that you ask as an institution when initially joining the effort. Number 1, is our leadership committed? Number 2, do we conduct timely screening and assessments? Number 3, do we have baseline data? Number 4, have we conducted a comprehensive process analysis and inventory of services? Number 5, have we prioritized policy, practice, and funding improvements? And number 6, do we track the progress we make? We are already doing some of the suggested items in this program and have seen positive results. The best example is Judge Skirta's treatment court initiative, which has had a very high recovery rate and has produced a variety of positive results. I applaud the judge and others in the criminal justice system who have supported this effort. These issues will not be solved overnight, and the solutions will require a great deal of work and focus. I thank my fellow commissioners for their support of this effort and look forward to working with everyone on every level to face the challenges of mental illness and substance use disorder in our prison systems. I'd also like to thank the probation department, the courts, the jail staff, and the prison board for their continued support of these efforts. When bringing this up to a number of different departments and organizations, the response has been very positive, and so I think that's a really fantastic sign of what we're going to be capable of doing in the future. And so I guess really quick, if everyone's okay, I'll just read through the resolution. Whereas counties routinely provide treatment services to the estimated 2 million people with serious mental illness booked into jail each year, prevalence rates of serious mental illness in jails are 3 to 6 times higher than for the general public. Almost 3/4 of adults with serious mental illness in jails have co-occurring substance use disorders. Adults with mental illness tend to stay longer in jail and upon release are at a higher risk of recidivism than people without these disorders. County jails spend 2 to 3 times more on adults with mental illness that require interventions compared to those without these treatment needs. Without the appropriate treatment and service, people with mental illness continue to cycle through the criminal justice system, often resulting in tragic outcomes for these individuals and their families. The recent closure of the forensic unit at the Warren State Hospital and the continued reduction of state hospital beds in the region have generated an overflow of inmates with serious mental illness in the Warren County Jail. The Warren County Jail and Warren County and all counties take pride in their responsibility to protect and enhance the health, welfare, and safety of its residents in efficient and cost-effective ways. The Warren Forest Courts have created a special drug court which handles designated substance use cases in order to provide a road to recovery for individuals with substance use issues and have produced positive results for the adherents. Through Stepping Up, the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation are encouraging public, private, and nonprofit partners to reduce the number of people with mental illness in jails. Now, therefore, let it be resolved that the Board of Warren County Commissioners do hereby sign on to the call to action to reduce the number of people with mental illness in our county jail, commit to sharing lessons learned with other counties in Pennsylvania and across the country to support a national initiative, and encourage all county officials, employees, and residents to participate in Stepping Up. We resolve to utilize the comprehensive resources available through Stepping Up to A, convene or draw on a diverse team of leaders and decision makers from multiple agencies committed to safely reducing the number of people with mental illness in jails. B, collect and review prevalence numbers and assess individuals' needs to better identify adults entering jail jails with mental illnesses and their recidivism risk, and use that baseline information to guide decision-making at the system, program, and case levels. C, examine treatment and service capacity to determine which programs and services are available in the county for people with mental illnesses and co-occurring substance use disorders, and identify state and local policy and funding barriers to minimizing contact with the justice system and providing treatment and supports in the community. D, develop a plan with measurable outcomes that draws on the jail assessment and prevalence data and the examination of available treatment and service capacity while considering identified barriers. E, implement research-based approaches that advance the plan. And F, create a process to track progress using data and information systems and to report on successes. And so that's my pitch.
Okay. Do I have
So-
a motion to adopt this resolution?
So I'll make a motion to adopt the resolution number, what was it? 30-something?
3087.
3087, supporting the Stepping Up initiative.
Second.
Any further discussion? Hearing none, all in favor, please state aye.
Aye.
Aye. Thank you, Commissioner Eggleston.
Thank you.
We're at the point where our agenda is complete, and we have some members from the community here. Does anyone have anything they'd like to add? Mr. Abel, please.
This is an issue that we raised Monday in the work session, and I just wanted to reiterate some points and actually recommend some actions by the commissioners. This has to do with herbicide application in Chautauqua Lake in New York. Chautauqua Lake is in the Conewango Creek watershed. All of the water that's in Chautauqua Lake that doesn't evaporate flows into the Conewango Creek and into the Allegheny. So it passes by a lot of our houses. It's something that it's water that many of us recreate in. We paddle there, we fish there, and in addition to that, some of our pets drink out of that creek. The herbicides that they apply have prohibitions for periods of time after application against swimming, against drinking, that includes pets drinking, and against fishing. The application that was applied in New York, which was permitted by New York State, to our knowledge, my knowledge anyway, Pennsylvania, either the citizens or the agencies in Pennsylvania who might have jurisdiction over this sort of thing were not notified. Warning signs that were placed around the lake. There were no warning signs placed anywhere that I'm aware of in Pennsylvania to notify Pennsylvanians that there might have been some hazard in the water. As I understand it, there are going to be future herbicide applications in Chicago Lake. These are going to be larger applications, and I think they could approach some threshold where they could affect waters in Pennsylvania, including Conewango Creek. At the moment, I think the recommendation that I would have is that in your normal work with the agencies of the state, whether it be DEP or other agencies that might have jurisdiction, principally DCNR or the Fish and Boat Commission, that we find out if those Pennsylvania agencies are indeed informed and involved in prior to those applications being made, or whether or not it might be appropriate for the state to get involved in some kind of environmental assessment, since that may be something that affects Pennsylvania. In addition to that, there is a county legislature meeting takes place once a month in Chautauqua County. There's a meeting tonight. I think it would be very useful if you had a chance to speak with your peers in Chautauqua County just to inquire about what they do have planned, because at this point I think it's something that's certainly going to be of interest to citizens here in Warren County. I don't know of any future applications of herbicide that are planned at the moment, but I understand those are in the planning stage. A number of us are planning to attend that meeting tonight and speak on behalf of, to the extent that we can, as citizens of the state of Pennsylvania, to express our concerns about applications that take place in New York that may affect us, over which we have no say. We're not even sure of whether or not there is a proper environmental impact statement that was conducted by the state of New York, and we really don't know how much of Pennsylvania lands or waters may have been affected. I might also add that this is of particular importance to farms that are getting water from the creek, especially those who have livestock that are being watered out of the creek. That's all I have. Thank you.
We really appreciate you bringing this to our attention. Have you brought this to the attention of our state legislators?
I work with an organization that is preparing a letter
Okay.
to our legislators to make sure that all of our state agencies that might be involved, and that could be a large number, get proper notification and seek involvement where that's possible. I'm not sure that that's precedented, and so I think this might be an excellent opportunity for the state of New York and for the Commonwealth of Pennsylvania to work together to create a cooperative agreement.
Agreed.
We share watersheds here in western Pennsylvania and New York. We share at least 4 major watersheds: Carmichael Creek, French Creek, Broken Straw, and Allegheny. So essentially, all the water that comes through Warren County begins probably somewhere in New York. So it's something that's going to benefit certainly the citizens of Warren County, but also the vast number of other citizens of Pennsylvania. And I don't know if this is accurate, but I have heard that there are as many as 1 million people who get their drinking water out of the Allegheny River. So I think this impacts Pennsylvanians, not only in Warren County, but
Certainly encourage you to reach out to them as you are us here. I know that Representative Rapp, Senator Hutchinson, and Senator yeah, I'm sure they would all be interested in hearing what you have to say, and I believe that they would have the means to contact, the secretaries of those departments and be able to get, the attention quickly of those secretaries. And I think that's important, especially in forming some sort of a cooperative agreement with Chautauqua. I think that's a great idea. Thank you. Appreciate your time. All right. Do I have a motion for adjournment?
So moved. Second.
Meeting's adjourned. Thank you, everyone.